Good afternoon. When I last spoke to you just under a week ago, there were 71 confirmed cases of COVID-19 in Linn County. Now we have learned that there are 176 confirmed cases here in Linn County, which represents a 148% increase in just 1 week's time. There are a total of 946 cases statewide and additional deaths. These numbers will continue to grow. As I've mentioned before, we're only able to know the confirmed number of cases of those individuals we test. It's sort of like finding only what you shine a light on. And since testing is limited, we should all assume that many more individuals are carrying the virus. And by now, we all should know that you can carry the virus and be asymptomatic. This is all the more reason we need to take social distancing and sheltering in place when we can very seriously. We're hearing from the federal level of government that we are approaching a critical moment in the arc of this pandemic. We're hearing this from the Surgeon General to Dr. Fauci and renowned epidemiologists the world over. Now is the time to dig in. Now is the time to double down on our actions and not let up. Now I know this isn't easy. It's not easy for me. The stress of this situation gets to me, the constant barrage of difficult news, learning about when we've lost another Iowan, and the social isolation of it all adds another dimension of loneliness that is quite daunting. But hard things are hard. And as I've said before, if we're going to beat this thing, it will be through shared sacrifice. It will be because we knew when to ask for help when the pressures of this crisis began to impact our mental health. It will be because we did too much while there was still time on the clock, as opposed to being reactionary when it was too late. This pandemic will have a clear beginning, a peak, and an ending. And since there is no magic bullet, no vaccine as of yet, we will determine through our actions or inaction how long this will last. Right now, we are the antidote. And on that note, I would challenge us all to think about this a little differently. We must view ourselves as the front line of defense in this unprecedented fight, and view the medical community as our last line of defense. And if we do our jobs well, we will make light work for the medical community on the back end. Linn County officials and our partners will continue to closely monitor the situation as it develops. We are committed to providing clear and transparent updates as they become available. This pandemic has brought the world and this community to our knees, but I don't intend to stay there. Our recovery begins the moment we all decide to act collectively and flatten the curve together through our actions. And if there was any skepticism about the realness of this thing or the severity, I hope it all has been dispelled. I hope going forward that all of us will commit to doing our part in slowing this thing down. And in closing, this crisis has shown us many things that will change our world going forward. But one of the nice things it has revealed is that there are a lot of heroes among us. From the folks making masks and gowns for our healthcare providers, to the volunteers delivering food to those in need, to the local businesses changing their operations to make hand sanitizer, to the interpreters and translators working hard to bring critical information to those who are hearing impaired or don't speak English, to the teenagers making time to give grandma a call. We should all be inspired by the good energy being produced in such a trying time, and we'll need all the good energy we can muster as we head into what could prove to be the defining moments of this fight against COVID-19. Thank you.
Good afternoon. My name is Heather Metter, and I am the supervisor for the Clinical Services Branch at Linn County Public Health. As of today, there are currently 176 cases of COVID-19 in Linn County. There have been 6 deaths, and 37 individuals have recovered. There have been 881 negative tests for COVID-19 in Linn County since our reporting began. Governor Reynolds has mentioned outbreaks of COVID-19 in long-term care facilities, including one in Linn County. Usually, Linn County Public Health is not allowed to release the names of facilities where an outbreak has occurred or is occurring. However, Governor Reynolds has released the name of Heritage Specialty Care in Cedar Rapids as a facility that is currently in the grips of a COVID-19 outbreak. There are over 70 cases associated with this outbreak, impacting the residents and staff. Linn County Public Health is working with the Iowa Department of Public Health and the facility to respond to this crisis. This includes following guidance that includes instruction on how to prevent the spread of infection, discussions about how to transfer ill residents to the hospital, monitoring the health of residents and staff throughout the day. We also want you to know that ill staff members are at home in self-isolation, and all residents are in their rooms in self-isolation. Regular group activities, gatherings, and group meals at the facility have all been suspended. Staff are using personal protective equipment during each patient encounter. This facility is closed to all visitors. All staff entering the facility are screened for signs and symptoms of COVID-19. This situation underscores that COVID-19 poses the most risk for those with serious illness, those that have underlying health conditions, and for older adults. These risk factors can be more severe and lead to illness, hospitalization, and death. Currently in our state, we have had 25 people die from COVID-19. It is imperative that we protect these vulnerable populations by practicing social distancing. Again, please stay home. We are in this together, and each decision you make, each time you leave your home, can have an impact on each person you encounter. All of our lives have been disrupted by this pandemic. We've said it before, and I'll say it again. This is not a sprint, but a marathon. It is important to remember through this marathon to maintain good physical health. As much as possible, keep a routine, which includes a focus on healthy eating and drinking water. Continue to take your medications and your vitamins to ensure optimal health. Also, remember to exercise regularly. When exercising outdoors, do so responsibly. When riding your bicycle or using the trails, maintain 6 feet between yourself and others. Do not gather in groups of 10 people or more. This is especially important to remember as our weather is becoming nicer and you are tempted to gather with large groups at venues such as camping or cycling. Even though you are outdoors, this virus can still spread to others. Take care of yourself and take care of each other. Thank you.
Good afternoon. Tony Myers, Vice President of Medical Affairs at Mercy Medical Center. Just first, real quick, Mercy has opened another respiratory clinic that is Mercy Care Prairie Creek. It's by Kirkwood, and so we still have the clinic in Marion as well. I want to try and put a little face on this about what's going on at the hospitals. We've had deaths related to COVID at both hospitals. We have multiple people at both hospitals that are on ventilators fighting for their lives right now. This isn't just, I mean, we've all seen what's going on TV and in social media, but this is going on right now in Cedar Rapids. It's here. Now, the cases, we certainly have the capacity to take care of these critically ill people, and we know that the majority of people that get this virus are going to be fine, but the people that get it, and especially the people that get it severely in their lungs, they are in for a fight. We know that based on what's going on nationally, that if you end up on a ventilator, your chances are not good. The fact of the matter is, we talk about susceptible populations, but this is hitting people that aren't necessarily elderly and aren't necessarily having lots of other medical problems. While that's certainly a risk factor for severe problems, we have patients in Mercy right now. The majority of people that are on ventilators are less than 65 years old, and that's just a fact. And it goes back to what Mr. Walker and Heather were saying. At this point, even because the medicines, they're getting the medicines that we hear about on TV, they're just not having much of an impact. The only thing that we know that will work is for people to not get it. And the only way that that's going to happen is we do what we've been talking about for weeks. We wash our hands, we stay in, we don't go out if we're sick, and we stay home. We need to stay home. We need to do better at staying home. That's how we're going to protect our neighbors and our family and our friends. We're going to prevent them from getting it. If you absolutely have to go out, then I'd encourage people to wear a cloth mask. This mask is not to protect me, it's to protect the other people in this room. Even talking loudly can cause spread of this virus. If I have a mask on, if I have to go out, please, please put on a mask to protect all of us. I can't stress it enough that over the next 2 weeks, even though the weather is beautiful and we want to fertilize our lawn and we want to go to the store and we want to plant and we want to do all that stuff that we do this time of year, it's not urgent. We don't need to do it. We need to stay at home. Thank you.
Good afternoon. I'm Noreen Bush, Superintendent of Cedar Rapids Community School District, and I'm speaking on behalf of the school districts in the Grant-Wood Area Education Agency region. Several weeks ago, on March 15th, Governor Reynolds issued a closure for all schools that would last for 4 weeks. That would be up until April 12th. Underneath that particular closure, schools were to provide opportunities for learning, and the only schools that could do required learning were those who qualified for online instruction. There are only 3 school districts in the state of Iowa that qualified for online instruction. However, last Thursday, the governor has extended school closure from April 12th to April 30th. So what has changed from the past several weeks to now? Under the current school closure, the Department of Education has provided additional guidance for schools for this closure time from April 12th until April 30th. There are several options for schools to provide what is called continuous learning underneath these few weeks. There are 3 options for schools. The first of which is schools can choose to provide no continuous learning, which means that schools would be required to make up the time lost during the school closure time. The second option is continuous learning that would be voluntary for students to engage in. And the third option is continuous learning that would be required for students to engage in. So the difference between voluntary continuous learning and required continuous learning is primarily students' attendance. And under a requirement, students would be required to attend coursework or required to gain access to the work being provided by schools, versus voluntary, which means school districts are supplying work, supplying access, but students would not be required to complete that work. It is optional. There's additional concerns in regards to required learning for many school districts. For an equity and access point of view, from Cedar Rapids Community School District point of view, it would be guaranteeing that all 17,000 of our children have the same access and the same equity lens to the learning that's being provided to them, and that we would have to guarantee all learning supports for what students are provided. So if a student qualifies for special education services, if they have a 504 accommodation plan, or even English language learning instruction, we would be required to assure that all students have access to that, and that we would be providing grades and feedback to students. Under voluntary, we can still provide all sorts of opportunities for students, including those in the subgroups that I just described. What the difference is we wouldn't require attendance and we wouldn't require grades. We could provide feedback, we can provide continuous learning, but it provides an opportunity for students to continue on their path without penalizing them for attendance requirements or grading requirements. Above all else, all of our school districts maintain a priority for the safety and the health of our students and our families. We absolutely want to provide continuous learning opportunities, but we want to make sure that they are safe and healthy. Thank you.
This is the end of our prepared remarks for today. We do have time for a few questions. We will take questions from the room first, and then we'll move to the callers that are on the phone. For those on the phone, please indicate to the moderator that you would like to be entered into the queue. And as a reminder to our speakers, please repeat the question before responding. Are there any questions for our speakers today? Mary.
So the question is, under the three options, whether that be no continuous learning or the two options of continuous learning being required and or voluntary, which is Cedar Rapids choosing? At this point in time, Cedar Rapids is going to start with continuous learning, and we're doing it voluntary for K through 12. We will be assessing specifically what to continue with at the high school level. School districts do have to submit their plan by April 10th to the Department of Education, and then we have to receive approval before we initiate our plan on April 13th. So as Cedar Rapids is considering voluntary continuous learning, that will include a variety of options. That does not necessarily mean it has to be online learning. It can be packets of work. It can be teleconferencing with students and providing feedback and support and assignments. It does not have to be isolated just to online instruction. So Cedar Rapids is going to try and provide a continuum of options for our families. We currently have some options, but we will be notching it up a little bit and making it more rigorous. Mary, what was the second part of your question?
It was about, I guess, well, I'll rephrase it more so. Since you all are going with the voluntary for right now, how do you make sure students have the required hours? since they won't be required to do the learning?
Sure.
Graduate or advanced chemistry?
So either continuous learning option, whether it be required or voluntary, the hours of instruction will be forgiven by the Department of Education. It is certainly concerning to us, the learning time that's missing for students. Our priority is their basic human needs, making sure that they are safe, that they are healthy, that their families are safe and healthy. We are providing meals for families that need that. Last week, we provided over 30,000 meals to our school district, to our students. The week prior was 25,000 meals. So we certainly are keeping those as our priorities, but families are home and they want their children engaged in learning. So we want to assure some more secure structures as we move forward. So we have a structure plan for elementary, for middle school, and for high school so that our students can continue on that path with a continuum of options. I'll give you one example though. I had a family reach out to me whose oldest child is a high school age student, 3 younger siblings, and both of their parents work for the hospital, essential workers. And they said, please, we want opportunities for our high school student, but he can't do too much right now because he's got to take care of his younger siblings while we are providing essential work. So we want to provide as many opportunities as possible, but also keeping in mind not penalizing children for this pandemic that we're all facing.
Sure, Ashley.
So we're seeing so many reports of there being a possibility of a lot of asymptomatic people out there who don't show any symptoms, don't know that they have COVID but could be spreading it. I'm wondering if there's going to be maybe any point where essential workers such as long-term care facility workers, police officers, people like that could get testing to just know if they have it or not, or if that would be explored in the future at all.
Sure, Heather, do you want to take the question from Ashley Neighbor on whether people can receive testing even if they're asymptomatic, if they're an essential worker? Is that the question? Okay.
Thank you, Ashley, for the question. So right now, essential workers that are showing symptoms of COVID-19, so they have cough, fever, other symptoms that might be relevant to COVID-19, are able to get tested. Now, where it comes to doing asymptomatic testing, that's still an issue. We don't have enough tests nationwide to be able to test those that are asymptomatic. So for essential workers, if they perhaps are living in a home with somebody that has COVID-19 or they've been around someone with COVID-19, we do enhanced precautions for those essential workers since they may be asymptomatic and we don't know if they have COVID-19. So if they're going to be doing, if it's a healthcare worker, if they're going to be doing any patient interaction, they have to be in a mask. So again, as Dr. Myers pointed out, the mask is not to, if I'm wearing a mask, it's not going to, it's so I don't make you sick. It's not so you can't make me sick. So those essential health workers would have to have a mask on so they don't potentially give something to somebody else. I would love to say that we could test all asymptomatic workers. We're not at that point where we have enough tests and that with the availability to be able to do that. So it would be great in the future, but as of right now, we really have to look at those that are sick so that we can make the appropriate diagnosis and provide the appropriate care.
Are there any additional questions from those in the room? What?
So we've heard like the county has put out initiatives where if someone were to get sick, they could have 2 weeks paid time off, special time. I was wondering for the hospitals, I know Unity Point's not your only Mercy, but I was wondering if the hospitals also has access to special paid time off if a doctor or a nurse was to come in.
Sure. So the question is for the hospitals whether they are offering for their employees paid time off related to COVID-19.
So I'm not an expert in HR, and HR is actually very complicated. But I can tell you this with certainty, like 3 or 4 weeks ago when we started to look at this and we knew it was going to be a problem, Mercy made the assessment that we needed to protect the workers, and so we are, and that includes financially.
Go ahead, Mary.
One more quick question for Superintendent Bush. Sorry to make you walk back up here. Specifically looking at high school students, since the voluntary continuous learning doesn't count towards their credit, how is the school district going about having them achieve that?
I'll rephrase it for you. Or go ahead.
So the question is specifically under continuous learning and the voluntary option, how do we assure that high school students are getting their credits? So achieving credit is a local control decision based on each school district. So what we do is we would assess the current state of each student and where they're standing, and how might we continue to achieve that credit as we move forward. So we have a great benefit in that we were able to, Cedar Rapids is on a semester schedule. We were able to get through our third quarter, and so we do have mid-term grades and standings, so to speak. We can require, all districts can continue to require learning through concurrent enrollment. That would be for dual credit classes offered through the college, community college. For us, that's Kirkwood. So those are classes that are going to continue with online opportunity and online access for our students. Secondly, we can require for credit recovery. So students who were enrolled in credit recovery or were in danger of failing a course, we can continue to provide required work so that they can assure their credits. Districts across the state, Cedar Rapids is part of what's called the Urban Education Network. That is the 8 largest school districts across the state. We're in constant conversation, really daily conversation, maybe hourly conversation about this very topic. So right now, it's how do we secure the credits for the class of 2020, and then assure credits for grades 9 through 12. We do not want our kids to be penalized because of this pandemic. So what we will be deciding is what essential learning was so important in every single course that we can assure kids achieved that. And then as we move forward, making sure that we have opportunities for kids to achieve their credit. They certainly can continue and receive letter grades. However, many of us are considering a pass or a credit, no credit option, so that if a student wasn't feeling secure in a course, they would be able to recover that credit at a later date, or the credit or the coursework that they needed to complete in order to achieve the credit. I think that what we'll be looking at is how are our kids doing up into the midterm? What additional learning opportunities might we be able to provide through the continuous learning option? And then making sure that we're assuring that our kids are getting what they need so that they can graduate on time.
So it'll be a student-by-student basis then?
I think we will have certainly a broad look at this for all kids, but then absolutely we will have to look at each student by student.
And I have one more question that was just
Sure.
one of my colleagues. If school, this current extension ends until the 30th, school does go back on May 1st, will the district extend the end date for the school year?
No, I think that the days will be forgiven at this point in time, and so we would keep with our current calendar date. One thing that we have requested or are in conversation with and would be very interested in some support from the Department of Education, would it be possible, especially for our students who are currently in grades K through 11, to potentially start before the required start date next year? And that could we get a jump start to the school year next year to get that foundational learning of anything that was missed. That's one idea of how we might be able to recover credit. In addition to that, Cedar Rapids Community School District has a very robust summer program called Kids on Course, and our hope would be that our health state would be in a place where we could continue that summer programming, and that maybe we could scale that in some way for all of our students.
I think we have time for maybe one more question from within the room, and then we'll go to our remote questions. Is there anyone else in the room with a question? Okay. So our remote question is from Brian Morelli at the Gazette. It says, Linn County is the epicenter of COVID-19 in one of the last states without a stay-at-home order. And my understanding is that there is continued discussion about whether local action can be taken. What is your reaction to the governor's latest expansion of closures? Does this go far enough? And what additional would a full stay-at-home order provide? I believe this is for Supervisor Walker.
Thank you, Brian, for the question. I need to start by saying I was unable to catch Governor Reynolds' press conference, but I was able to get some top lines from my staff, and I understand there have been several other closures issued in her latest proclamation. The operative question is this: what can we achieve through a shelter-in-place order? And I think that's what everyone is trying to figure out. And I think that as you look, we'll have a lot of learnings from other states here in the Midwest that have issued shelter-in-place orders, and we can see if that is having a material impact on slowing the transmission rates of COVID-19. And early indicators suggest that it's happening. I know that there's a lot of work being done at the local level to understand the legal authority to issue a shelter-in-place or stay-at-home order, and it appears as if Iowa Code allows for mayors to do that. I know that there are some mayors around the state that are sort of working to better understand this legal ability as outlined in the Iowa Code. And I've maintained all along, if Cedar Rapids and Marion, our major urban centers here in Linn County, would abide by a shelter-in-place order, that Linn County would issue one. One of the, to wrap up, one of the last pieces of a shelter-in-place order that I'm particularly interested in is the enforcement piece. And I think when you issue a shelter-in-place order, that jurisdiction is able to empower its law enforcement apparatus, whether it's municipal police or sheriff's deputy, to enforce that. So if we know that there are places that are in violation of our stay-at-home order, or we know that there are companies that aren't abiding by best practices and social distancing practices, there could be they could be facing legal trouble with that, and our peace officers can enforce it. And that is one of my big interests in getting to a shelter in place. But I credit the governor for continuing to turn up the heat and do everything she can do to make sure we're being safe and we're slowing the transmission of the disease, of the virus in this state. But I would encourage the governor to continue to think about doing everything we can do while we have the time to slow this, the transmission of this, and to hopefully manage hospitalization rates in the future. As I mentioned in my opening remarks, we are hearing from the federal level that these next 2 weeks are critically important. And what we do now will have consequences for the future in making sure our healthcare system is not overrun. So in my view, if you can do something to slow the transmission, to mitigate the hospitalizations, then I think we should do it.
This is a related question from Kate Payne for Dr. Myers. What other actions would you want state leaders to take to expand or enforce social distancing?
Yeah, I'm not a politician, and so I talk to the leaders, and what I say, and to all of you, I'll say it again. I want us all to stay home unless we have to go out, and that's how I'm going to answer that question.
This question is also from Kate Payne. Are there efforts to gauge how many people are sick with COVID but haven't been tested, or even have died of a likely COVID infection but were never tested? Okay, it does not say who this question is for. Would either hospitals or public health like to answer that question?
So, I'm sorry, can you repeat it?
Sure. The question is, are there efforts to gauge how many people are sick with COVID but haven't been tested, or how even have died of a likely COVID infection but were never tested?
Anybody that we think might have had it, then they get tested, is the short answer. So I think even if that's somebody that would potentially have died at home, the medical examiner would test them.
And I believe this question is for Heather. This is, again, from Kate Payne. Have there been other cases at other nursing home facilities? And if or when that happens, will these facilities be identified?
Kate, thank you for the question. According to the Iowa Attorney General, we cannot release that information. So if that did occur, unless we had guidance from the governor, her office, or the Attorney General, we would not be able to release that information. And again, that's to protect the confidentiality of the facility and of the patients and of the staff members that would be caring for those residents.
This next question is from Brian Morelli. It says, I have heard anecdotally about crowding and people not following social distancing at outdoor areas with the nice weather this last weekend, including at Ellis Park and Cedar Lake Trail. Outdoor recreation continues to be recommended as a last refuge during a time when so many places are closed. Is this something you are observing, and do you have any plans to address this?
Well, I don't want to speak on behalf of the city of Cedar Rapids. I do know that all governments are interested in enforcing social distancing practices in our community. If you think about this question could also apply to county parks. And we know that it's important for us to exercise and be healthy and get out in the outdoors when we can, even as we face this pandemic. And what we are seeing, and our county parks department and commission that governs all of that are doing a great job at policing, if you will, these areas and making sure that folks are in compliance as they recreate. What we also know is this. Our law enforcement agencies right now are primarily serving a sort of public education function. And the folks who are not in compliance with social distancing sometimes just need to be informed of that. Our sheriff's deputies aren't out looking to arrest folks or issue citations. They're out to educate. But in the event that people are willfully ignoring the governor's proclamation, or if we get to the point where there is a shelter-in-place order at the county level and city level, our peace officers will be empowered and encouraged to issue citations and take whatever measures are necessary to ensure public safety.
I believe that's our last remote question. I want to say thank you to our remote media personnel. Our phone line was congested today. I think there must be a lot of people holding virtual meetings, so we didn't get them connected via phone, but I just want to thank them for their participation remotely. So this does conclude our press conference for today. Our next scheduled press conference is Thursday, April 9th at 3:30. Just a few notes in closing. I'd like to briefly summarize our Linn County metrics to date. Linn County has 176 cases with 6 deaths. We've had 881 cases, or 881 negative tests, excuse me, and 37 individuals have recovered from COVID. And I also just want to remind everyone that's watching to please practice social distancing, stay home when you're sick, and wash your hands often. Remember, stay safe and stay home. Thank you.